how to address reluctance with older adults when perhaps they do need support and resources, but are reluctant to accept it because I don't want to take something away from somebody else. Maybe somebody else will need it more. Or I don't think I'm really that bad off. Older adults might be reluctant to admit that they have distress or mental health concerns because of stigma, which disproportionately impacts older adults, especially related to mental health concerns. I've heard all of these as reasons that older adults are sort of reluctant to accept care. And so I want to address how to talk with older adults about that. Like Americans of all ages, older adults might be unfamiliar with government services for which they're eligible, particularly after a disaster. So you might point out, depending on the funding for your program, that the older person's taxes have helped to pay for the assistance that's being offered. So, in a sense, they have contributed to the assistance that they're getting. If an older adult thinks that accepting help will mean taking services away from those with a greater need, you could make them aware that many programs require that community needs be measured after disaster, and services then get planned to meet those needs. So if we're not clear about who needs the services, programs won't get the funding that they need to provide the services. And then if you talk about options for mental health care and substance use care, avoid using clinical language. And so I think a conversational style that connotes respect and dignity and autonomy. Once that trust and rapport is built and there's some collaboration happening between you, then to offer some psychoeducation and support